I remember when I had low back pain, there was a lot of conflicting information about imaging. You need to get imaging. Imaging is a waste of time. Maybe you've already had imaging done, or you're thinking about getting imaging to find the cause of your back pain. In this video, I'm going to clear up some of the misconceptions around imaging for back pain and give you a more informed perspective on the topic. Welcome to Back Unbroken. I'm Nate. I'm a doctor of physical therapy, so make sure to subscribe if you're suffering from back pain so we can get you moving in the right direction. Before we jump into this, I do need to preface this video by saying that none of this is medical advice. I can't diagnose or understand your specific situation through a YouTube video. I can't tell you whether or not imaging is appropriate for you as an individual. That's a conversation for you to have with your physician or a licensed physical therapist. But what I can do is give you some of the facts about imaging so that you have a more informed perspective when making this decision. So let's jump right in and discuss some of the realities of imaging. Most people have the perception that imaging will show them the root cause of their back pain. And this is a totally reasonable assumption. It seems logical that looking at the inside of your back would reveal the problem. But this isn't always the case, and it's actually more of an exception rather than a rule. Imaging can be helpful for seeing things like fractures or muscle tears or disc bulges, but it doesn't show pain. Pain, especially long-term or more chronic pain, is much more complicated than this. And it often doesn't present itself as a single physical thing that you can see in an image. In fact, when we do imaging on people who have no back pain at all, their images often look very similar or identical to people who have severe back pain. In a blind trial, just looking at two different images, it would be nearly impossible to say who's in pain and who isn't. To prove this point, let's look at a study that was done in 2017. In this study, they took 10 different MRIs of a woman's lumbar spine in 10 different clinics. These images were then given to 10 different radiologists to interpret them and determine diagnostic findings. And the results won't give you much confidence in imaging. Out of the 10 interpretations, there were essentially 10 different findings. In other words, the results were completely different based on where the MRI was taken and who was interpreting it. We also know from studies like this that there's a huge amount of people who have no back pain at all but still have abnormal imaging findings that we would expect to result in pain. This all just reinforces that imaging is not a very reliable tool for explaining someone's pain. Now, you may be asking yourself, well, even if imaging isn't that great, I might as well get it, right? There's no harm in extra information. And again, this seems really logical, but there are some downsides to imaging that may cause you to think twice. An obvious one is the cost. These things are not cheap, especially if insurance doesn't cover the full thing. But a less obvious one is that seeing imaging results can often cause people to become more fearful of their bodies and their pain than they were before the imaging. Think about it. If you get your imaging results back with a big scary image and a bunch of unpronounceable findings, it might freak you out a little bit and cause you to move more carefully or exercise less. And those are two things that we know contribute to more back pain. And we actually do have research suggesting that unnecessary imaging can prolong recovery and make chronic conditions worse. Not to mention that it could open the door to surgeries or other invasive procedures that might not even be warranted. Again, I can't speak to your individual condition or situation. You need to talk with a licensed professional to get an opinion. But when we look at the research on the vast majority of back pain cases, imaging is often unnecessary and even harmful in a lot of situations. So what should you do with this information? Again, I can't say for your specific situation, but just know that imaging isn't quite as magical as we once thought it was, and it's not always helpful or necessary for back pain. Remember, it can show anatomy, but it doesn't necessarily show pain. Thank you for watching. As always, if you're struggling with nagging back pain and feel like you don't have a game plan to get rid of it, head to backunbroken.com to see how I can help. I'll see you next video.